You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We have the go-to dentist in West Texas for dental implants, Dr. Bob Leedy. Dr. Leedy, welcome to the program.
How you doing, Randy? Good seeing you.
All right, well, I'm glad you finally made it. And in all, it's a fact, I've been begging you to get out here for 6 years, and you finally decided to do it.
Finally got time. We got things lined up right.
It took the San Diego Rock and Roll Marathon to have you come out.
My wife ran in that yesterday, and she's recovering today.
Good. Now, she works there with you too, right?
She works at, we have office in Fort Worth. She has an office in Fort Worth, and I have one in Abilene, so we kind of split time between the two.
Okay, good. Now, and I know you brought a stack of photos.
Bunch of pictures.
So we'll show those. But for people that don't know your practice, I mean, who's the typical patient that comes in for dental implants?
Some of dental implants, it can range from 20 years old to 90 years old. I mean, it's a wide range. There's people coming in frustrated with their teeth.
Okay.
People that frustrated with teeth problems they've had their whole life. And they're just wanting a way out of the pain and problem they've been having.
Now, is it true in your office, people can walk in on the day of the procedure with no teeth, walk out with teeth, upper and lower, that don't come out?
Absolutely.
Really?
It's got to take some planning ahead of time. They can't just walk in off the street and get it done the next day. But we have planning ahead that we get everything together, and then they'll walk in can have a full set of upper and lower teeth. We can extract the teeth, place the implants, and attach teeth to them the next day.
Now, this is like the main focus of your practice?
Definitely.
Dental implants?
Yeah, dental implants for 20 years. I've been placing implants for over 20 years. Things have changed so much in that 20 years.
Yeah, what's changed? Because you said even the prices have come down.
Yeah.
It's faster today.
The things we do, I was doing cosmetic dentistries back in the 90s when that was the new greatest thing in dentistry. And it was great. We gave people smiles they didn't ever have before, man, pretty, but implant dentistry so changed how things go. It's from making their smiles better to chewing, eating anything they wanted to. It is truly life-changing compared to a nice smile. Nice smiles are great, but teeth.
So this is the happiest group of patients.
This is the happiest group of patients. And this is the greatest time in dentistry. I enjoy what we do so much more than anything else we could do.
And you're in a unique place. I mean, in Abilene, there's really no other general dentist doing what you're doing, where you can go in and get a full arch of fixed teeth that don't come in and out.
Exactly.
Is that right?
Yeah, we have our own lab in-house, so we're able to place the implants, convert the bridge onto the teeth the same day, and deal with any kind of problems we may have after the fact.
Now, we should mention, I guess how it's normally done is you go to one place for the surgery, another place where you put the teeth on top, and another place for the imaging. You do it all right there. Now, aside from convenience, what's the advantage?
Just the fact that we have control over getting the results we want.
Okay.
And the cost is a big part. We can save patients money just by doing everything in the same office and make sure we get the results that they want.
So where you are, I guess within like 100 miles of your practice, are there a lot of people wearing dentures?
Oh yeah, lots of them. Tens of thousands of people with dentures. Dentures are on their way to dentures. Just pretty much anywhere you go, you're going to meet people that's what their next step is dentures.
Is dentures.
Right.
And you say no more dentures. Now, if dental implants are so good for these denture wearers, where they could come in and get teeth again, why aren't they all doing it? What's your take?
Part of it is knowledge about what can be done. That's a big part of it, is just not knowing what can be done. Fear is huge. Most people are scared to death of going to the dentist. And most people have gone to the dentist over and over again and keep having results that they just have to redo or have painful experiences. They're not going just because they don't know what's available, and they're not going to the dentist. So they've just got a floating around denture that they think that's as good as it gets. My dad's a perfect example. My dad was 20 years old when he got his denture. And when I started doing implants over 20 years ago, I went to him and said, Dad, I'm gonna put some implants in. He said, oh no, I'm good. I can eat anything I want. I don't need any denture or any implants. I said, okay. So I did my first implant his name's Don Wilson. First implant I ever did over 20 years ago. And he still comes and sees me every 6 months, and we take care of his teeth. But finally convinced my dad to come in and let me do implants on him. Because he was able to eat corn on the cob. He had everything he wanted. He had regular dentures, but he'd always had that for 20 years. With my dad, he didn't really care to have implants done. I convinced him to let me place some implants and give him some locked-in teeth. And once we did, he just couldn't believe the difference that was. I mean, he could eat things even better, even though he thought he didn't have any problems with eating. This now allowed him to eat everything he wanted, and security with his chewing was unbelievable. So when we placed the teeth with my dad and they were just snapped into place, he got a big smile on his face and started eating, and he ate things he hadn't been able to in forever, even though he thought he could eat anything he wanted to. He all of a sudden could eat everything that he possibly wanted.
Is this one of those things where your dad says, I should have done this years ago?
Absolutely. I mean, I had tried to talk him into it, and I'm a dentist, and he still didn't want to get implants done. But once we placed them and snapped his teeth into place, it totally changed his demeanor. He's smiling all the time, eating everything he possibly could, and it was life-changing for him.
So how old can you be to do this?
80 plus. I mean, I've got patients in the past month that we've placed implants on and screwed teeth onto that were over 80 years old, 88, late 80s. We've got 30-year-old. I did a 30-year-old patient this past month that was frustrated with his teeth, lost all his top and bottom teeth. So quite a range.
Is that right? So it doesn't matter. I mean, statistically, if you're 90 years old, they're not more likely to fall out?
No. And the people that age they get food brought to them all the time. They want to be able to eat the food that you bring them. Even the patients in the nursing homes, there's food there all the time. They got to the point they don't want to eat baby food.
Okay, good. Now you brought photos. What are we looking at here?
Got several patients here. Here's a patient that this is probably as good a smile as I could get out of Phil.
Okay.
Phil came in and wasn't smiling whatsoever. And he came in and was going to lose all his teeth. Had no choice. He realized that. He's at the end of what we can do with his teeth. Losing them from periodontal disease, getting loose. And so we went in and gave him a cosmetic upper denture and gave him a locked-in lower denture that was hooked onto implants. Here's a smile before, up close.
Oh, wow.
And there's a smile after. And it totally changed his personality. He was an outgoing guy, but he just never really let it loose and got that big smile going until now.
Looks nice.
Yeah, Phil even did a commercial for me.
Oh, he did?
Yeah, just that he could eat anything he wants, talking about chewing corn on the cob. He used to always have to cut it off the corn, and now he can eat it like everybody else. And it's amazing what it's done. He has a conventional upper denture, and he has a lower that's locked into place. This is Jim, and Jim's somebody else that's as good as he smiled. That is Jim's smile. That's about all there is to it. Here's what Jim had going on. He had an overbite, pretty severe. We were able to save his bottom teeth, but he was going to denture on top, no matter what. He was going to lose his top teeth, and he knew that. So we went in and placed implants and attached teeth to him all in the same day. So he came in the morning, walked out with a smile that looked like this.
Very nice.
And you could tell just the way it changes his eyes, his smile. I mean, and he can chew now too, on top of that.
How soon could he eat?
He pretty much could eat later on that same day. Had to be careful with it. Couldn't go chomping on a steak right away. He had to work his way up to that. But It took probably a month and a half, 2 months before he could really get into that heavy steak that he was so desiring.
And now they can eat whatever they want.
Pretty much eat anything he wants. Yeah.
Do you get a lot of eating stories?
Lots of eating stories.
Like they want to tell you?
Yeah. Usually everybody walks in with what it is they've been missing they haven't been able to eat. And there isn't hardly a patient that can come in and say, this is what I haven't been able to eat. I haven't been able to eat chicken or corn on the cob or steak. And usually after this procedure, in no time at all, they're able to eat that type of food.
We're going to take a quick break, and we come back. More about the dental implant process, what they can expect. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I was trying to hold on to my teeth for as long as I could, and something I was very self-conscious about. It got to the point to where they were talking dentures, and I knew with technology today that's something that I didn't want to be the end process. With fixed implant dentures, it allows you to eat anything you want. Corn on the cob, apples, pork chops, steak, anything you want. You can tell I don't have a problem with that. I'm a guy, and we don't tolerate pain in our mouth at all, period. So I told him that was my only concern. He assured me that everything would be fine. It is a night and day difference. I wouldn't, if you're dreading dentistry or something like that, the way Dr. Bob and his staff does things, they make you sure that everything's going to be comfort. They're going to take care of you. They're there to help you with your problems. So, I would recommend it to anybody for any circumstance, whether it be a full arch or a single tooth.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to Dr. Leedy, nobody should be wearing a loose-fitting denture. Dr. Leedy, welcome back to the program.
How you doing, Randy?
Now, do you think dentures as we know them today, whether it's 50 years or 100 years, that the future of dentistry, all dentures will be attached to something, like dental implants?
Yes. There's so many different ways to attach teeth in dental implants. It's changed the whole profession and how patients are able to eat and smile and everything else.
Okay. You have more photos. What do we
I do.
look at?
I've got some more photos. Here's another patient, Randy, that came in, and she actually had been wearing dentures since she was 30 years old, and she was getting ready to turn 60. It's Connie.
And that's her smiling?
That's her smile. That's as good as we could get her to smile at that time. And so she came in wanting to know what could be done. She'd been told by several dentists she didn't have enough bone left to do implants. And with the technology we have now and the cone beam, we could go in, and I looked at her bone and decided that we definitely could get her fixed up with a full upper and lower fixed in place
Set of teeth.
implants, set of teeth that are in there. She doesn't take them in and out or anything. Her option was just making a new denture. The old denture had worn and she couldn't function with it anymore, but she wanted something fixed in place. So we gave her upper and lower fixed teeth that don't come out. So here's an after of her smile. You tell what it changes in her, just her eyes and the way she looks. So one afternoon we gave her a full set of teeth that don't come in and out. They're in place. She can eat anything she wants. She wanted to go to Bell's Chicken and have chicken. That was her biggest thing. So she went and got her some chicken after we got everything fixed up with her. Probably the most rewarding thing about Connie is she comes in and talks about how it's changed her life every time she comes in. And her husband usually comes with her, and he's always pulls me aside and he tells me how much it's changed their life and their relationship together.
That's nice.
Yeah, I mean that's probably where the rewarding part of doing this comes, is how it changes the patient's life, and not only that, all the people around them.
I guess in other things you do in dentistry, could be very artful, cosmetic dentistry or whatever.
Right.
They don't thank you the way they do, you say. Told me in the green room, like this is a different type of gratitude.
Right. Yeah. The difference between this is, like I said, cosmetic dentistry changes the smile. This really changes how they are able to function in life, honestly. I mean, it changes everything they do, from just activities, smiling, eating.
Now, this particular lady is one of the videos that I saw on your website.
Right.
And she said she went to this chicken place and ate as much fried chicken as she could.
Right. Yeah.
So that's common. People just want to.
Something they all desire something that they haven't had in years and years.
And so it doesn't matter how old you are.
No, at all. I've had patients that we've gave teeth to that were 30 years old, and patients that were almost 90 that have done implants that teeth were screwed into place.
Now tell me about the sedation part of this.
Right.
So because it doesn't hurt during the procedure, obviously. Tell me a little bit about what to expect.
Patients are all numbed up. We give them some oral sedation, a couple little pills that lets them sleep through the appointment. We can talk to them. They can answer. They just don't remember anything. It's got great.
Is that right?
Quality.
Okay.
Works out great to be able to have. Some of these procedures, they might be in the office for 5-6 hours. If we're doing upper and lowers, they might be in the office 5 or 6 hours. Most of them don't remember anything about the appointment.
Feels like they were there for 10 minutes.
Yeah. Come in the next day for us to do a follow-up, and they're like, I remember walking in, and I don't remember much else about that.
Is that right?
Yeah.
And now, so what are the options? So a denture wearer goes in, or somebody with bad gums, can't save their teeth, comes in. Take me through the different levels of what you're able to do.
There's different things we can do. We can just take their teeth out and give them an upper-lower denture. Upper and lower dentures are the pits. Bottom dentures float around. Top dentures sometimes will stay up okay, but bottom dentures are just awful.
They're no good.
Okay. No good. We can do upper denture with something on bottom that's attaches, locks into implants, helps hold it. It doesn't. They can take it in and out, but it holds
like
it
a
into
snap
place.
in, snap out.
Right,
Like
holds it
what,
into place.
2 or 3 implants, or what do you
usually
do?
3 or 4.
Okay.
3 or 4 implants. You can do it 2, but it's still got some rock to it. 3 or 4, it's locked in there good. We do that on lowers and do a regular denture on top. Patients do okay with that too. Then you go into the ones that are attached. They don't take in and out, and that's the Cadillac of.
That's what everybody wants, right? Teeth that don't come out.
Makes all the difference in the world.
And is it? And they could last. Like if somebody's 30, they could last as long as they last.
The teeth themselves could wear over a period of time where we have to go in and replace the tooth part, but the implants are still solid, the little bar that attaches them. So once in a while we have to kind of retread them go in
Okay.
and put new teeth on them, but we always have their temporary set, their backup set we can put in while we're doing that. But that's after 10, 15, 20 years maybe.
So isn't it true though that if you've been wearing a denture like 20 years, you can't do this? You don't have enough bone.
No, not true at all. Sometimes patients are told they don't have enough bone if either the technology the other dentist has used isn't what we're using these days. We've got a cone beam x-ray we take on everybody that's a 3D x-ray that allows us to determine where we're going to place the implants and predict exactly where we're going to put them. So I haven't had a patient yet that we haven't been able to do something for. Whether it's a couple implants holding the denture in to full mouth that we're putting 5 and 6 implants in and screwed into place that they don't take out. Here's another picture. This is actually a physician in the area that really didn't know what could be done dentistry-wise. He just knew he was getting ready to lose his teeth. Take a look at his before,
Wow.
where you can see his teeth.
That's got to be unusual.
No, it's not. It's not. He was losing his teeth. He knew that wasn't good for his health. There's a lot of problems now between dental disease and cardiovascular problems.
Okay.
So he knew that. He knew it was time to do something about it, but he didn't want a denture. He
didn't want a denture.
Didn't want denture taken in and out. So we came in and we placed implants and gave him a full set of teeth that were in there to stay.
Let's take a look at that.
Here's his evidence. And it changed his smile too. And
Wow.
not to mention health. I mean, he's going to be a healthier person now that all that infection is out of his mouth. And he knows that.
Now, when he looks in the mirror for the first time, do you remember? I don't know. I mean, what?
Oh yeah, he got
That's a big change.
Big change, big old grin on his face, and you could just tell that his confidence level, he just kind of bowed up a little bit. It is a big, huge difference.
So, do they like the way it looks, or do they like the chewing part? What do they like?
Everybody's different. They all, kind of, some people come in because of the chewing, but then when you get done, it's like, oh wow, this looks good too.
Okay.
And the people coming in that wanted the looks, it's like, oh, this is great that we can chew. So they usually will experience how great both parts of it, but most people come in for one or the other. A lot of times when we get them a smile that they're proud of and happy with, all of a sudden they're taking pictures. People think they're happier people. They might not have been unhappy before, but now they're showing their teeth and they don't look mean. They don't look like they're irritated all the time. And they're taking pictures. They're taking pictures with their grandkids. They're taking pictures. Someone's starting to learn Facebook, doing selfies and stuff like
Doing
that.
selfie.
People that never would have taken pictures previously. All of a sudden got a big smile.
Now, we talked a little bit on the phone and in the green room that people with bad teeth are judged. People
Yes.
think, like in Hollywood, if you're going to make a movie, you want to make somebody poor, you give them bad teeth. You want to make them uneducated, you remove one of their front teeth.
Right.
The criminal always has the gray teeth. The fake con artist has big fake veneers. So teeth are,
Huge in how people react to you, even though you're the same person. They react to you differently depending on how the teeth look, and even people that can't eat and function properly. They're going and slipping off to the bathroom to do something. They're kind of playing with their food, not completing the meal, and people think maybe they don't like my cooking. No, it's they can't eat. They can't get through that meal because it's embarrassing to them. This is Rick Abbey, and he is my lab guy. He helps me make all these teeth now.
Okay.
He came to me, he's been a lab tech for 25 years, making removable teeth, whether it's dentures, whether it's partials. He's done that for 25 years.
And what was he wearing in this photo?
He had natural teeth that were bonded together, some crowns. He was losing his teeth. And he came to me probably 3 years ago. He had done some work for me years ago and used to make the teeth dentures for me and such. He came to me wanting to know what I could do for him. And I told him the only thing I really can do is take your teeth out, place implants, and give you teeth that are in place that you don't take in and out. And he's a little skeptical. He was one of those, your typical dental patient, as nervous as he could be.
And he was in the business of making
He's
teeth.
in the business. And he is scared to death of going to the dentist.
Okay.
He came in and we actually did guided surgery on him. So I went in and planned everything and did a guided upper and lower because I didn't have a lab tech to convert it. He was my lab tech.
Okay.
So I had to go in and do a guided surgery. He came in the office. We took all his top teeth out, his bottom teeth out, and gave him fixed in place teeth.
Nice.
And this is a smile afterwards. Totally changes it, how things go. How his smile is. A big change in Rick is if you look at the picture, that's as good as a smile we can get. That was hard to get out of him. And
So
now
he was
walks
just a
in
not smiley guy at all.
not smiling. He didn't have any back teeth either. All he had was a few front teeth. And so he didn't want to smile big because people would see he didn't have any back teeth. And he couldn't hardly chew with the front ones he had. And all of a sudden we give him teeth that are fixed into place. And now he's smiling big. It's totally changed. Like, even look at his eyes. Look at his eyes, how he just glows more. And he walks in the room, he's always leads into the room with his smile now, whereas he didn't used to at all.
Okay, good. We're going to take a quick break. We come back, and you have a few more photos left.
Yeah,
We'll try to get to
few
those.
more.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
The main reason that I came to see Dr. Leedy was to get a beautiful smile again. You know, you're busy taking care of family and you kind of put yourself last. Prior to my smile, I did a lot of this. I was constantly kind of hiding my teeth because there was too many spaces. Eating was horrible. Yeah, I was nearly baby food stage. Now I could have it steak, corn on cob, apple, anything. Just get in here, get your teeth fixed, you'll be so much happier.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to Dr. Leedy, nobody should be wearing a loose-fitting denture. Dr. Leedy, welcome back. You got a lot of photos.
A lot of photos. Could show you photos all day long.
And your website, I mean, it's like patient after patient after patient talking about how happy they are.
Yeah.
You know, going into this, and we talked, I said, it's just teeth, though. You say it's more than just teeth.
Yeah. It is, like we talked about it, cosmetics were great, but implants are life-changing for these patients. It's the most rewarding thing I've ever done. I've been practicing over 30 years. This is the best time in dentistry right now.
That's good.
It's great. This is a patient that's about as good as she could do smile-wise. This is Nora.
So people just learn to smile kind of covering their teeth.
They had, and she actually had some crown and bridge work that had broke off, and so she was hiding it even more. And so we went in and extracted the remaining teeth because she knew there was the teeth she'd had a lot of dentistry done, but it was all failing.
You couldn't save the teeth.
Couldn't save the teeth anymore. So we went in and had to take the teeth out, place implants once again, and gave her some teeth that were mouthful teeth that are in there to stay.
Wow.
And even there, you can tell in her eyes, she just brightens the room when she comes in. Put those side by side, Randy. You can tell with her. This is 2 weeks after we did her surgery. And before, she was having a hard time smiling. And afterwards, you can see now, these are all in her mouth. Doesn't take them in and out. You can see she's learning to smile again. It's been years since she smiled like that. And
They look like veneers.
no, we've gone in, we've done all the things I learned in cosmetics, but we're doing it with dentures now too.
Okay.
So it's the same concepts as veneers. These are just placed on implants now. Used to be, if you were talking about cosmetic dentistry and implant dentistry, those didn't go together. Implants, nothing on implants was pretty 20 years ago. Now it is, we can take implants and we can combine that with cosmetics. We can make implant dentistry beautiful and pretty also.
Nice. I mean, it's a very sweet look, like that smile. It's very sweet, very nice, looks age appropriate. Look, I'm not trying to side with you too much, but these are good photos, so good for you. I know you have some more.
Yes.
And I don't mean to rush you, but we got about a minute and a half
Okay.
left.
This is, I have patients come in all the time and said, am I with the worst mouth you've ever seen? And I always tell them, no, you're not. This is the worst mouth I've ever seen. This is Michael Brooker. And I did Michael's teeth probably 12 years ago. And he came in, he had where his jaws didn't develop properly. He had teeth growing in the roof of his mouth. This is as good of a smile as we could get. And his teeth were all decaying. And Michael actually had some people from his off where he worked put a fund together to help him in paying for his dentistry. I mean, it was...
Oh, that's nice.
It was very moving, that the fact that they knew
They pitched in.
He had a personality that wasn't coming out. So we did a couple surgeries on him. This said 12 years ago. Went in, placed implants, and he walked out. And here's the smile he had after we walked out.
It's very nice.
Yes, and it totally changed his personality. I mean, he was hiding that smile, and he's smiling all over the place now. And he's been coming in every 6 months for the past 12 years. Got to know each other. He looks forward. He'll tell everybody he looks forward to coming to see his dentist because they're his friends. And that's very touching and rewarding from a dental standpoint. This is a guy that was scared his whole life of going to the
So
dentist.
he would have had dentures,
Yeah,
maybe if he didn't meet you.
Exactly. I mean, he'd have been regular dentures flopping around. He was in lots of pain previously with the teeth he had that he couldn't chew because he only had a few teeth hidden. So going from not having teeth that that floated around to ones that snapped in, locked into place, is totally changed.
And it's definitely changed his appearance.
Oh yeah, big time. And his personality. I mean, he is one outgoing dude now.
So we are out of time.
Just one more.
Okay, one more. 30 seconds.
This is a lady that came in and she'd had a lot of dentistry done. Here's her before, Randy, and she had gum disease and her teeth were flaring out. So she really couldn't bite on them like she used to be able to. They flared out, and so we went in and removed her teeth, gave her screwed-in teeth that are in there, don't come in and out on implants.
All right.
Totally changed how her teeth function and her profile. You can see her teeth aren't sticking way out like they used to.
And they can eat whatever they want.
Eats whatever she wants.
Like, what about hard things? Like, okay, so once they're healed up, like a carrot with their front teeth.
Absolutely.
Like a heart. Really?
Absolutely.
Nuts? No problem?
Nuts, apples,
Chewy
corn
things?
to come, chewy things. Yes, pretty much anything they want to chew and eat, they can now.
Okay. We're out of time. So final message to the patient that's watching this. Maybe they're wearing a denture.
Right.
They think they're fine, like your dad, right?
Right.
Or the other patient that they have bad teeth. Can't save those teeth.
Right.
But for whatever reason, they've heard what you had to say, but for whatever reason they're afraid or they're putting it off. What do you say to them?
Just give us a call. Let us call. We'll do a free consult for you. Do one of those 3D X-rays we're talking about to see what your options are. I mean, there's so many different things we can do, and we can go over different costs it's going to be.
Okay.
And we have financing in the office, so we can find a way for you to afford your dentistry being done.
Now, we should mention Medicare doesn't cover dental implants, Medicaid, even the best dental insurance doesn't cover the whole thing.
No, they don't. But we have financing in the office, Randy, that allows the patients to get this type of work done. Either the patients can't afford it, but have good
like
credit,
decent credit, they can do
decent
it.
credit where they can get the financing. Some patients that might have the money don't want to let it up and let go of it, and we'll do financing with them too. So try to find a way that fits into their budget to allow them to get the dentistry that they want done.
Okay, people are driving great distances to see you.
Yeah,
Is that right?
We've got them coming from all over West Texas these days.
Like
now.
where?
Brownwood, I have San Angelo comes to see us, Breckenridge, Snyder. Abilene is the main spot, but we've got people driving an hour and a half, 2 hours away.
Okay, so if you have a denture,
Right.
you got to see Dr. Leedy, right?
Absolutely. Good.
If you have teeth, like bleeding gums and the bad breath, the gum disease, and you're worried you're headed to a denture,
We can take care of both.
gotta see.
If you've got teeth that you're losing, we can get you fixed up with something that doesn't come in and out. If you've been taking it in and out and hate the way it's been, we can fix you up with something
Okay,
that
good.
also is attached in there.
All right, well, thank you for coming to the show.
Well, thank
Great
you.
stuff.
Appreciate it.
You've been watching the Wellness Hour, news that makes you healthier. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.